I'm Dr. Hampton Howell at Salem Plastic Surgery. I'm a board certified plastic surgeon. I just wanted to explain the difference between a breast lift and a breast reduction because it's a question I get asked very commonly in consultations. So a breast lift is where I lift and I reshape the breast. I maintain all of a woman's breast tissue and thus maintain her breast volume. So we're not talking about cup size changes, but we're talking about very significant shape changes. So for instance, a woman who likes the volume of her breast as it fits in her bra, but does not like the drooping and the sagging that she has, is a great candidate for a breast lift, where again, I'm lifting and reshaping, but I'm maintaining that volume. A breast reduction, on the other hand, is actually a very similar procedure where I'm lifting and I'm reshaping, but in addition to that, I'm removing some of the breast tissue, and I'm doing it in select areas to maximize her shape, but also get her to the size and the volume that she wants to be when the surgery's finished. So that's for somebody who obviously the breasts are larger than what she likes. In some cases, it can be a very, very large reduction, and those are ones that possibly may be covered by insurance. They a lot of times contribute to things like back pain and neck pain and that type of thing. Some cases are small reductions that are done as a cosmetic case. Breast lifts are done as a cosmetic case. Of course, I go over all that with a patient at her consultation and go through the plan and go through really a customized plan for her specifically to best meet her goals from a size and a shape and the appearance standpoint. In fact, in some cases with a breast lift, we actually add volume, like with a breast implant, to give just a little bit of fullness if that's helpful for the shape, again, depending on the patient's preference. The scars for both of these are typically very similar. With a breast lift or reduction, it's almost always going to be a scar that's at least around the nipple and from the nipple down to the fold under here. But if there's enough drooping, then an additional scar down here is needed to help give a nice shape. And in my opinion, the scar is well worth it to get the right shape and the right contour, because the scars really tend to heal very nicely. They typically tend to be fine line scars. They mature over time. And we give our patients product or give them access to product to be able to try to minimize the scars. It can really be a gratifying procedure for patients. I really enjoy doing them, and I like talking through it with patients. Pictures can be very helpful, and I of course go through those at a consultation, but you can look on our website at salemplasticsurgery.com. You can search me on Real Self and look at pictures there. You can also search for patient experiences on Real Self, where patients who've gone through these procedures have sometimes written reviews, or they've just written about their experience. And those are all just ways for different levels of curiosity of patients to help answer those questions. But I like to go through a very, very thorough consultation. So I hope all of that is helpful. They're great procedures, different ones for different people. Hope that's helpful.